Okay, we have Jessica Smith, a 31-year-old who's here for physical examination and painful periods. She reports increased flow, heavy flow with her periods that are regular at 28-day cycles, associated bloating and diarrhea, and lower back pain. She also reports dyspareunia, and ibuprofen helps some. She takes that. Heating pad has helped some. Warm baths have helped some.
How much often was she taking it? The ibuprofen, how much?
2 tablets every 4 hours is needed during her periods. Rates pain is 7 to 8 out of 10. Makes her stop what she's doing. Describes the pain as cramping, but not radiating in quality. Severity hasn't changed. She's had this condition for a couple of years at least.
How severe was it again?
7 to 8 out of 10, with no radiation of the pain. But she does report pain, lower pubic area pain, also lower back and her sides at times. History is significant for she had a C-section with her first child, also had an abortion, has been pregnant two times. She takes vitamin D, 5,000 units once a week. Allergic to sulfa, which gives her rash or hives. Doesn't smoke, drinks rarely, no history of drug use, has had 2 sexual partners in her life, a boyfriend and her husband, and she's been with him, currently lives with him and son. Family history, mother with breast cancer and hypertension, father in good health, son has autism, maternal grandmother with stroke and at age 80 and hypertension. Doesn't know the rest of the family history. Exam, afebrile, does have tenderness on palpation of posterior vaginal fornix, no cervical motion tenderness, has a retroverted uterus, some left adnexal tenderness to palpation. So, could be fibroids, but she does have some pain with them. Dysfunctional uterine bleeding, perhaps, for a differential. Endometriosis. Can't afford to miss ovarian cancer. Doesn't seem super likely. Salpingitis would be another possible. I don't think something like polycystic ovary syndrome, because she's only 124 pounds, doesn't have any of the other features that go along with that. The same thing with a retained foreign body, nothing seen on exam, so that can be ruled out with the exam. Things to consider, I would offer her a pregnancy test if she thought there was any chance she could be pregnant, although it doesn't seem like it. Her cycles are regular and she had one recently.
It would never be out of order.
Exactly, with a fertile female. That's why I would offer it, but not...
No, you would do it.
I would do it? Okay. I would do a pregnancy test. I would do a CBC. If she's having heavy periods, she's had them for a while, just make sure she's not anemic. And pelvic ultrasound to make sure we don't have fibroids or something else going on there. She can continue Tylenol or ibuprofen as needed for pain. Also heating pad, warm baths, since those have helped. I would suggest she begin some regular exercise. That might help if it's just run-of-the-mill regular period kind of pain. Continue breast self-examination. She's really pretty good about follow-up and everything. So as far as follow-up with me, I would follow up with the results probably by phone. I would have her call if she's having change in regularity, frequency, amounts of bleeding, or any symptom like fever that developed along with it. And then follow-up with me would be based on what we found. If there's something on that, like we showed fibroids or something on the ultrasound, then I'd probably refer to the gynecologist.
Okay. What was she using for birth control again?
Condoms. And was happy with that method.
Okay. What abdominal symptoms was she having? Any change in stool, blood in stool?
She was having a little bit of diarrhea when she had her periods.
Okay.
Denied really anything else bloating, she said, but
Okay.
with periods, so hard to get too upset about that.